Lung cancer is the leading cause of cancer deaths in men and women. Austin CyberKnife uses their advanced and precise technology to treat lung cancer patients, giving them hope and quality of life. And Douglas Rivera is a radiation oncologist and the medical director with Austin CyberKnife. He's here with more, and we talked about those statistics, #1 cause of death in men and women. What are the new screening protocols that are happening that help with finding this cancer?
Yeah, so one of the reasons why it's so deadly, so it's not the most common cancer that occurs in folks, but because we catch it very, very late, it is always pretty advanced. So now there are some screening protocols that have come over the last couple of years showing the benefit of doing screening CT scans. And so we are catching a lot of these things a lot earlier, particularly at high-risk patients who are particularly smokers.
Yeah, and that's great news. So tell me about how you at CyberKnife treat lung cancer in particular.
So we try to take a multi-specialty approach to it. Obviously, like to get medical oncologists involved and also surgeons. There are going to be a large subset of patients, however, because there's smoking history and other medical risk factors that just aren't going to be good surgical candidates. So for them in particular, it's a really, really great modality because they can still be treated for the lung cancer safely, non-invasively, with no surgery. Oftentimes, if they're even able to bring themselves to their treatments and drive themselves home. So it really is a really nice alternative. And even now in growing popularity for even patients who might consider to be surgical candidates, it's also another alternative for them as well. And it's really growing rapidly.
What about the number of treatments? Does that vary from case to case? I know that that is significantly decreased, though, with CyberKnife, too, right?
It is, yeah. Traditionally, radiation would be 6 weeks of therapy. There's lots of different reasons why that's been shortened down, but this is more effective to do less of them and very intense and high dose. We're able to kill the tumors better. So typically, you would not get more than 5 treatments under this approach. Average would be about 3. There are some protocols maybe even doing as little as 1 treatment.
And as those treatments happen, where are you in relation to the patient? And it's a robotic situation? Is that kind of what we're talking about?
Yeah, so the radiation oncologist and the physicist and the whole team really kind of do a lot of the work on the front end, doing the planning and things while the patient is at home. And when they come on in, we get things set up, and it is a robotic program. And one of the things that differentiates the CyberKnife in particular, there are other machines that treat similarly to this, but this is one of the ones that actually tracks the tumor and can move with it because of the articulation of the arms. It makes it very special in that case.
And also just kind of speak to the fact of people being able to have that non-invasive procedure and get on with their daily activities if they can, as they're able to, right?
Yeah. I think most people are really surprised how easy it is. They expect a lot more, even though we tell them that it is non-invasive. The fact that they can come in there, get the treatment, and they really don't, most people really have very little in the immediate kind of 72 hours afterwards to even say they felt anything related to the treatment. So they're really quite pleased with that, and most people are always surprised, I think, overall with how easy it is.
Nicely surprised. All right. Thank you so much. We appreciate it, Doctor. Austin CyberKnife is located on I-35 near the Del Seton Medical Center at the University of Texas. You can call them at 512-324-8060 or go to austincyberknife.com.